welcome to our Mind Myself special event, full bloom book overview and a healing meditation with our two fantastic practitioners. This is part two. And the reception was so great for part one. Everybody said, yes, let's do part two. So I'm Esther, founder and CEO of Mind Myself. And it is my pleasure to be bringing you these events. And I want to tell you a little bit about Mind Myself too. For those of you who don't know what we're offering to the world, our vision is to cultivate unity in times of divisiveness. Perhaps you might have experienced some of that over the last few years. And also creating ways for you to feel seen and heard and supported in your health journey. There's so much confusing information. And how do we know where to look? And how do we know what is already vetted and true, etc.? So our goal with Mind Myself is to provide that information for you in a beautiful and safe and clear method. We have over almost 100 podcast episodes now. We've had a number of events over the past 2.5 years. I think it's close to 20 now. So you're welcome to check out those recordings at any time. We have many blogs, over 50 of them, to read at your heart's content, should you like. We have 70 different healthcare approaches identified and described all in one place. And we have 265 health issues just for a beginning. It's not about diagnosing, but it's about getting you started, getting trusted and valuable information. And most importantly, we have a number of practitioners like the two who you're going to meet shortly, who can help you as you navigate this journey. And of course, our goal in all of this is to help you become your own best health advocate, because nobody knows you better than you do. I'd like to do a brief land acknowledgement. I live in Surrey, BC, and we are so grateful for the people who came before us and whose land it is unceded for us, but we are so grateful to be able to live, work, and play on these lands and drink this water. And I want to thank the practitioners who are here with us today, Dr. Victoria Monlock and Dr. Melissa Crawford, because without the practitioners, we can't provide you with the information. So we're going to get to meet those beautiful women in a couple of moments, but I want to start off with just a very brief quote. Gertrude Stein says, "We're always the same age inside. No matter our external age, we're always the same age inside." So we're going to talk about solutions today, about balancing our hormones, about dealing with what's going on inside in a holistic and a reasonable manner, because there are solutions. Let's begin by introducing our practitioners, and they're going to tell you a little bit about themselves. So Dr. Vicky, take it away.
Thank you, Esther, and thank you for hosting this wonderful opportunity. And I hope that people, if you have questions, please put them in the chat and ask so you don't forget your questions. I'm Dr. Victoria Monlock. I'm in Wisconsin, just west of Milwaukee. I'm board certified OBGYN, but had added complementary alternative medicine, wellness medicine, energy medicine, and regenerative medicine to my practice. So I had a very well-rounded approach in what I did with first women and then with the men in their lives, because wellness works for women and men equally. We all carry the same hormones. It's just that women carry two more. Otherwise, our bodies work exactly the same, which is kind of an odd way of thinking about it, but how true that is. I've been in practice for over 35 years. I am recently no longer in practice, but my mission is to continue to educate and empower. And I am still here to answer your questions, because that is my passion, is to educate and empower. And being in private practice for over 35 years, I could do medicine the way I felt medicine needed to be done. And I allowed my patients to partner with me during their health journey. So that's me.
Thank you, Dr. Vicky. Dr. Melissa.
Thanks, Esther. It's lovely to collaborate with you two ladies. I love that we have the same mission to educate and put the power back in everybody's hands. So I'm Melissa Crawford. I'm from Nelson, BC, and I'm a former family doctor. I left family medicine in 2018 and started a journey of studying energy medicine and kind of inner work, helping people with that mental, emotional, spiritual work in addition to the physical. So I'm really passionate about looking at the whole person because we're so much more than just the body, and helping people reconnect to their true essence, the true self, who they really are on that soul level, and just clear the obstacles to that. And that activates the person's innate healing capabilities. The body knows what to do. We just have these blocks that are in the way, and that's what I love to get to, is like getting to the root cause of dis-ease in life, like health, relationships, money issues. So I don't specialize in any area particularly. I'm not a menopause specialist, but I see a lot of women with hormonal imbalances who come to see me, whether it's perimenopausal or just cycle issues, not even in the perimenopausal stage, sort of just regular cycle stuff, and then menopausal, postmenopausal. And my overall approach is the same with everyone that I work with, is getting to those unconscious limiting beliefs, the stuck emotions, the spiritual aspect, helping them reconnect to themselves, and their body just starts to do what it knows how to do when we do that. So that's what I'm going to be doing with you today, is guiding you in a meditation into your body to tend to the energy. And I'll tell you a little bit more about that before we get started after Vicky speaks.
Excellent. So just before you get going, just to set the stage, Vicky will have about 30 minutes. Melissa will have about 30 minutes. Then we'll come back together and then we'll have a Q&A session. So as Vicky alluded to in the chat, just type the word question. I'll give you a sample and then insert your question after it. I will keep track of those as we go along. Over to you, Dr. Vicky.
Thank you, Esther, and thank you for hosting this wonderful opportunity. And I hope that people, if you have questions, please put them in the chat and ask so you don't forget your questions. I'm Dr. Victoria Monlock. I'm in Wisconsin, just west of Milwaukee. I'm board certified OBGYN, but had added complementary alternative medicine, wellness medicine, energy medicine, and regenerative medicine to my practice. So I had a very well-rounded approach in what I did with first women and then with the men in their lives, because wellness works for women and men equally. We all carry the same hormones. It's just that women carry two more. Otherwise, our bodies work exactly the same, which is kind of an odd way of thinking about it, but how true that is. I've been in practice for over 35 years. I am recently no longer in practice, but my mission is to continue to educate and empower. And I am still here to answer your questions, because that is my passion, is to educate and empower. And being in private practice for over 35 years, I could do medicine the way I felt medicine needed to be done. And I allowed my patients to partner with me during their health journey. So that's me.
Thank you, Dr. Vicky. Dr. Melissa.
Thanks, Esther. It's lovely to collaborate with you two ladies. I love that we have the same mission to educate and put the power back in everybody's hands. So I'm Melissa Crawford. I'm from Nelson, BC, and I'm a former family doctor. I left family medicine in 2018 and started a journey of studying energy medicine and kind of inner work, helping people with that mental, emotional, spiritual work in addition to the physical. So I'm really passionate about looking at the whole person, because we're so much more than just the body, and helping people reconnect to their true essence, the true self, who they really are on that soul level, and just clear the obstacles to that. And that activates the person's innate healing capabilities. The body knows what to do. We just have these blocks that are in the way, and that's what I love to get to, is like getting to the root cause of dis-ease in life, like health, relationships, money issues. So I don't specialize in any area particularly. I'm not a menopause specialist, but I see a lot of women with hormonal imbalances who come to see me, whether it's perimenopausal or just cycle issues, not even in the perimenopausal stage, sort of just regular cycle stuff, and then menopausal, postmenopausal. And my overall approach is the same with everyone that I work with, is getting to those unconscious limiting beliefs, the stuck emotions, the spiritual aspect, helping them reconnect to themselves, and their body just starts to do what it knows how to do when we do that. So so that's what I'm going to be doing with you today, is guiding you in a meditation into your body to tend to the energy. And I'll tell you a little bit more about that before we get started after Vicki speaks.
Excellent. So just before you get going, just to set the stage, Vicki will have about 30 minutes. Melissa will have about 30 minutes. Then we'll come back together and then we'll have a Q&A session. So as Vicki alluded to in the chat, just type the word question. I'll give you a sample and then insert your question after it. I will keep track of those as we go along. Over to you, Dr. Vicki.
Thank you. And knowing that we had part one before, but for everyone who might not have had the opportunity to see or view part one, I'll do a quick overview of what we did. But what I really want to focus on today is the fact that women all experience menopause differently. You experience it based upon you. It's an individual experience. It's your journey, which may look different than your best friend's journey, which may look very different from your sister's journey. We all walk into our menopause and perimenopause and postmenopause with health conditions and with organ systems that may be a little bit compromised. And that change in hormone is going to highlight those areas of need. In other words, everyone's going to have slightly different symptoms, and you're going to have slightly different resolution of those symptoms, but we all will go through a drop in our hormone. It's how it's going to impact each and every one of us based on what we individually have going on. So with that being said, let me do a quick overview. When we are talking about women's health, it's putting the science back into women's health. And people kind of hear that statement and go, I don't understand what you're trying to say. Well, I'm going to ask a simple question. When was the last time your doctor checked your hormone levels? And most women, when they have that question asked to them, they go, never. And they simply asked what my symptoms were and then put me on medication to cover it up. Well, that's not really science. So my approach is, hey, let's put the science back in. If you go to the doctor for a thyroid issue, they're going to do blood work to see where you are. If you go to the doctor with issues on any other organ system, they're going to do blood work to find out where you are. Why is female health exempt from that? Why do we completely ignore the fact that we make hormone, we make hopefully age appropriate levels of hormone, not just are we in reference range? And that's the first that I'm going to talk to you about and in review is, what does a hormone graph look like as women go through puberty to menopause? Well, I'm going to turn my screen here just a smidge to show you that this is actually from my research with my patients. This is the graph that shows for the decade of the 20s, 30s, 40s, 50s across the bottom, and the percentile of female hormone, solid line, dashed line male hormone, percentage of testosterone versus percentage of estradiol progesterone. What you see is low testosterone. Thank you very much. But you also see a very sawtooth up and down to get to age 30. You see a little smoother transition from 30s to 40s. But then you see again this very sawtooth up and down throughout the 40s with a little last hurrah, I call it, at 50 as you're entering menopause. Now, most importantly, take and step back just that little bit. And what do you see in this graph? Yes, month to month, there's variation, but what you see is a bell curve. So I'm going to ask the very simple question. If you are in your 30s, would you want hormone levels of a 45-year-old woman? No, it's not age appropriate. By the same token, if you have lower levels than you should, what might your testosterone do in response? And those are all relationships that medicine never talks about because they don't check your levels. They'll simply cover your levels up, and you never know what the real root cause is of what's going on. Secondly, and I'll just turn this for a second. Secondly, is realize your female male hormones are one leg of your hormone chair. What do I mean by that? The foundation of your health. Think of it as a four-leg chair. Your female male hormones are one leg. Your thyroid is the second leg. Your cortisol is a third leg. And your insulin is the fourth leg. All four of those hormone legs are equally important. They all have to properly balance each other. And if one leg is compromised, or if one leg is broken, it puts additional stress on the other three legs. So what happens when you sit on a chair with a broken leg? Boom, you're on the floor. What that may cause is the second leg to break, which may then cause a third and then a fourth. So think of those organ systems, those hormone systems in your body as the perfect foundational balance. That's what our body's health is built upon, is the balance of those four hormone groups. And it's really that simple. So in women, we have the additional estradiol progesterone with our testosterones. Men, they simply don't have the estradiol progesterone, but they have the same four foundational hormone groups. By the same token, can women and men have symptoms that relate to if they have inappropriate levels of estradiol, usually too low or too high? Do they have symptoms that go along with too little progesterone or too high progesterone? Or do they have symptoms that go along with too much testosterone? And of course, the answer is pretty obvious. If you have too much or too little of something, you're not in balance. So again, everything is about balance. So symptoms-wise, there is a hormone symptoms worksheet. I won't review that again this time. It is part of one of the links that you can get. It is also part of the book, Full Bloom, and that's the book we're talking about tonight. But know that starting with where are your symptoms, that's going to correlate with where are your hormone levels, which is going to correlate with the age that you're at. Now, the kicker is that, again, everyone walks into perimenopause and menopause with what you are. We take you as you are. So let's just say that there's somebody who has rheumatoid arthritis. There's somebody who has Hashimoto's. There's somebody who has a history of heavy bleeding. These are different symptoms, but they didn't just come out of nowhere. They're coming from hormone imbalance. So again, we're all, each and every one of us, going to present with different symptoms because your body is going to be able to be vulnerable in its weakest spot. Some of our weakest spots may be a genetic tendency, like a MS. You may have a tendency toward, and a genetic tendency toward MS. It's one of the case studies I do want to talk about. You may actually have autoimmune tendency, and that's your immune system attacking systems in your body. That's rheumatoid arthritis. That's Hashimoto's. You may actually have such stress in your life, which it can be financial stress, physical stress, emotional stress. There are many different types of stress, but stress can also put undue pressure on your known diseases and diagnoses that you have. And again, it's part of that balance versus imbalance that's going on. The other kind of fourth hormone that nobody ever gives credit to is insulin. Everybody gets a blood sugar checked, but nobody pays attention to the fact that insulin is the hormone that regulates the sugar. We all think of insulin as a treatment, as a shot that you give yourself. Maybe it's in your belly, maybe it's in your arm, but we think of it as a treatment. But really, our body makes insulin. And it's only when that insulin it becomes resistant to what's going on in our body, or if we have a genetic tendency that we are going to not have a pancreas able to keep up with what our daily dietary requirements have for us, that we're going to end up with an insulin resistance and perhaps pre-diabetic, diabetic tendency. But again, know that we are going to go through that graph that I showed you. When you hit age 50 and a half, average age of menopause, you will drop production in your body of estradiol and progesterone. That's just the way it is. And people say, well, then, isn't that just the way we're supposed to stay, is not have hormone? Well, a little known fact is that in 1912, the average life expectancy of the female was 48 and a half years old. Menopause didn't exist. We never got there. So the science of menopause is relatively young, whereas men make testosterone all throughout their life. In fact, by age 100, they're still making 20th percentile of their testosterone. So without further ado, I want to jump into some of those case studies, some of those women who are showing what they are coming to the table with, what they're walking in with symptoms of, and how that impacts what their menopausal story is. So I want to take women of every decade of perimenopause through to menopause, and that's in your 40s all the way to your 80s. Okay, and what we would do and how they would present and what it meant for them to be able to address their symptoms. So the first patient is a 47-year-old, and she has menopausal symptoms, but she also has Hashimoto's, that's thyroid, autoimmune thyroid. She has migraines, she has extreme PMS, and she actually has a deficiency in how to methylate, which impacts her cortisol. So she's pretty much got something impacting all four legs of her chair. So when she comes in, the symptoms that she has and what she's been told by other doctors are, well, there's not much we can do to help you. Even her endocrinologist told her with her Hashimoto's, there's not much we can do for you. Once you have positive antibody, you have positive antibody, and that's just the way it goes. Well, Her symptoms she walked in with were 8 estrogen deprivation symptoms, 4 progesterone, which were primarily emotionality and depression, constipation, headaches, and she also had minimal testosterone excess symptoms, but both her female hormone labs showed she was estrogen dominant, making a lot of estrogen, no progesterone, and very low testosterone. So she actually had been told that there was nothing that they could do for an estrogen dominance either, but know that imbalance is going to cause a problem, and estrogen dominance is going to cause potentially a bad mammogram right from the get-go. It's going to cause thicker lining in a uterus. It's going to be problematic. So what we did was, first of all, identify what her issues were, and then we flipped and rebalanced her female hormone. And what that ended up doing for her was taking and literally wiping out 90% of her symptoms. Her Hashimoto's antibody levels came down when we took gluten out of her diet, and her endocrinologist couldn't believe it. Well, those levels just will never come down. Well, we proved that they did. She proved she could feel better, and she never went back to the endocrinologist and found a new one. So again, she presented with issues in 3 of the 4. Another woman, and we'll just call her Mara. Mara at age 52 came in with ovarian and breast hyperstimulation. What would that mean? Well, most of the time, that means hormone imbalance where you have excess estrogen. Too much of a good thing. Think of estrogen as a fertilizer. Think of progesterone as the lawnmower that keeps the grass from getting too long. So if you hyperstimulate lining in a uterus, it's going to get too thick. You're going to bleed. If you hyperstimulate an ovary, you're going to build a cyst, which is going to get bigger and bigger and bigger and bigger. And what do cysts do when they get too big? They might actually go, and now you have a lot of pain, discomfort, and you might even end up in a surgical situation because they're not certain where that fluid may have come from and they want to test that fluid. So when she first came in, her hormone levels were showing estrogen dominance, and estrogen dominance to the point of she was an 80th percentile with estradiol, no progesterone. It didn't even register. And her thyroid showed low thyroid, but still within normal limits, normal cortisol. But the point is we rebalanced her, and we literally took care of her breast tenderness. We literally took any tendency for any ovarian cyst formation to occur, and she felt like she was back to age 35. So again, it's understanding the symptoms that can go along with what is out of balance. A woman in her 50s with interstitial cystitis, which is bacteria that gets into the wall of the bladder. Now, that can be very painful to have a bladder infection, but this is not bacteria in the urine, it's bacteria in the wall of the actual bladder. So when you expand a bladder, it hurts. When you contract a bladder, it hurts. So it hurts all the time. Well, know that estradiol is responsible for blood supply per square inch to tissues with estradiol receptors. So you can guess when we did her hormone level that her estradiol, sorry, I'm looking from the book itself, that when we did her estradiol levels, her estradiol was a reasonable level, but no progesterone, but her testosterone level was actually at 150th percentile. So she was more male than female. So what we had to do is actually, and her doctor took her off all hormone that she had been on, which just really brought out her interstitial cystitis. We rebalanced her, restarted her. All of her symptoms went away. She still has interstitial cystitis, but she's able to manage it, which meant she could sleep through the night, which meant she could go more than 2 hours awake without having to find every bathroom within a 15-minute radius of where she was. And she was thrilled. So going on to somebody who may present when they're in their 60s. And this particular patient had rheumatoid arthritis, multiple menopausal symptoms, and again, nobody talked to her about hormone. So rheumatoid arthritis is actually something that is autoimmune, and rheumatoid is something that it's not really, it's very difficult to manage, but most people just assume that you're going to end up with a joint replacement someday, and there isn't much of anything you're going to be able to do about it. So when we did her hormone levels, and again, her age was 61, she had both her estradiol and progesterone registered at first percentile, but testosterone registered at 33rd percentile. So she was again more male than female. So we corrected her balance of her female hormone, made her more female. And with the list of symptoms she came in with, she said she improved every single one of her symptoms, but only lessened her joint pain. Well, lessening joint pain is huge. And all we had done is worked for 8 months with her. So knowing that this could be a continued progression was really, really, really important. Another patient that presented with, and this is a patient who age 74, she's a breast cancer survivor. And you go, oh my word, what are we going to do with a breast cancer survivor? Everybody assumes that all breast cancer is actually due to hormone. And that's not a true statement. But this particular woman had what is called triple negative breast cancer, which meant all 3 of the markers were negative. So it meant estrogen negative, progesterone negative, so not fed by female hormone, and a marker called HER2, Herceptin 2 negative. And it can be a very aggressive type of breast cancer. She was treated, she survived, but her physician told her she could never go on hormone. Well, if it isn't fed by hormone, then why can't she be on hormone? So she went approximately 15 years before I met her. And when she walked in the office, she was miserable. She thought she felt good, but the symptoms that she checked off said no, she really was fighting low grade of everything, of not having female hormone around for years. So we actually put her on hormone, and she was nervous at first, of course, but she actually took every single symptom off of her sheet and actually started doing exercise, started doing more things with her husband, was brave enough to actually resume relations with her husband, and all of her continuing visits with her oncologist, she got her oncologist's blessing that this is something that she can continue to do. So, and that's important after you've been told for 15 years that you have cancer, you have the big C on your forehead, and there's nothing you can do about it. The last one I want to leave you with is actually an 83-year-old. Now, this 83-year-old came into my office with a stress fracture in her foot and a diagnosis of osteoporosis. She wasn't tolerating the pills, Fosamax, that they had put her on. And she said, Doc, I've already got osteoporosis. I already have a stress fracture in my foot. I don't want another stress fracture, and I don't want it someplace else. So what can I do? So we talked to her about hormone. As you can imagine, 30 years without having any hormone, her levels were definitely in first percentile across the board. And when we started hormone on her, the rule of thumb is that it's going to take time for you to actually put your mineralization back into your bones. But the better question is, can you remineralize your bones? So we repeated a bone density at 2 years, which is at the time that was the standard of care for when you repeat a bone density on a patient with osteoporosis. And we demonstrated that we had reversed her bone loss from osteoporosis, not just to osteopenia, but normal. So we took an 83-year-old with a stress fracture in a walking boot, terrified to do anything physical, to the point where she regained normal bone density. And she literally was the sole caretaker of her yard. She had called at one point to say, don't tell Doc, don't tell Doc. But my riding lawnmower fell over on me while I was on the hill. And I got out from underneath it, rerighted the lawnmower, got back on and finished cutting the lawn. I know my son is going to call and tattle on me, but tell her I'm fine. I didn't have any aches or pains. I didn't break anything. I feel great. So that's the last case study that I want to end with. I thought it was just really, really telling, and realize people at different ages and stages of perimenopause, menopause, you're going to present with different symptoms. You're going to present with what is happening to you, what is your issue, and how is it exacerbated by lack of hormone, and what can putting hormone back in and rebalancing it with your body, what that can do for not just quantity of life, but quality of life, what that's going to do for your mental health, what that's going to do for your spiritual health, because now you are balancing you in multiple aspects. And that's really what it's all about. So there is a call to action that I want you to do. I want you to remember that we talked initially about the 4 legs of the chair, the 4 foundational hormone groups. Well, the last chapter in Full Bloom is called How to Talk to Your Healthcare Provider. So in that chapter, I'm going to list for you the labs that you need to get done. And it's very, very intimidating to walk into your healthcare provider's office and say, I have these symptoms going on and I would like these lab tests done, because they're the doctor and they have control over what they're going to do with your health. But by the same token, you know your body, you know your symptoms, and now you have a book that you can arm yourself with, and you can say, but this is why I want to do this. Full Bloom gives you the power, and it empowers you to say, these are the labs that I want to get done, and this is why. So bring the book with you when you go to your healthcare provider. And if they say to you, I can't do these labs for you, the system won't let me do these labs for you, then I want to share with you one last thought. Know that you can order your own blood work, especially if you're from the States. I think it's a little tougher from a Canadian standpoint, but in the States, you can go online, you can order your own blood work. The results will get sent back to you. That means you have control over who sees those lab results. So know that you can take them to your doctor. That's perfectly fine. If they say, I don't know what to do about it, then you already know Dr. Melissa is an MD and can help in the Canadian system. I'm in the US system, even though I'm no longer actively seeing patients, I will take a look at labs for people and I will help put you in a direction of where you need to go. But it's important that you understand that this is putting science back into women's health. So I want to thank you very much for your time and attention. And again, if you have questions, put them in the chat. But I want to make sure I've got enough time left over to turn it over to Dr. Melissa.
Fantastic. Thank you so much, Dr. Vicki. And we do have some questions for you. So we will make sure that we bring those up during the Q&A section. So wonderful. Thank you, Dr. Melissa.
Thanks, Dr. Vicky and Esther. That was awesome. That's wonderful information, and I highly recommend getting Dr. Vicky's book. It is really amazing, and I love that you use the word balance so many times, and that is a goal in the work that I do too. And we're going to be focusing on bringing balance to your system overall, your nervous system, to all your organs and glands. We're going to do some guided energy work and meditation, and yeah, work on the root energy in your body. And because we're electric energetic beings, we have an electromagnetic field that passes through this body, and anywhere there's blocks like stuck emotions and beliefs, the cells aren't able to get the energy they need to do what they need to do, including the secretion of hormones. So we're going to work on pretty much almost the whole body, including those 4 pillars that Dr. Vicky talks about: the pancreas, so your blood sugar, insulin, the adrenals, the thyroid, and the reproductive sex organs, the ovaries. So yeah, so get started. And I like to get everybody grounded and feeling centered and connected before we dive into the body. So just feeling your feet on the floor, taking some deep, slow breaths. Letting go of the stress of the day. If you need to have some big sighs, go for it. Just really bring your awareness to the parts of your body that are making contact with the chair or wherever you're seated or laying down. I do recommend sitting up because this particular meditation really does put people to sleep. So yeah, staying upright is helpful. But if you need to sleep, that's cool. Just re-listen to this afterwards another time. So we're acknowledging and thanking the earth below us, Mother Earth, for her beautiful energy, and thanking her for filling us up with her grounding, protective, mothering, nurturing, loving energy. So just visualizing the core of the earth, a golden, sparkly energy. It's connected to you through these luminous roots, these grounding cords. So just see that beautiful golden sparkly energy coming up those roots and coming up the soles of your feet and spreading slowly throughout your entire body, up your legs, just feeling the relaxation, the safety, the love moving up your legs. Up into the hips, the pelvis, your belly, your chest, flowing down the arms all the way to your hands, and up into the neck, shoulders and neck, and throat area, and up into the head and brain, all the way up your crown, and just spilling out into your energy field all around you. And then looking just a few feet above your head with your mind's eye. That's the energy of your consciousness. So just projecting that energy up into the cosmos. We're all going to go up our personal spiritual portal that just makes us feel more connected to that source energy that we are a spark of. So this source energy is in all of your cells. It's going to feel like we're going up and out somewhere else, but really what's happening is we're going into the nucleus of all of our cells. So projecting that light that's above your head out towards the stars and other planets, towards a series of bright white lights. These are different planes of existence, dimensions. And you're just going to go towards them and through them. several bright lights with some spaces between them. Then in the distance, just keep going up and up and up. You'll see a jelly-like substance with all the colors of the rainbow. That's the laws of the universe. Just heading through that and keep going up till you see the brightest white iridescent light so far with a pink mist in front of it, the law of compassion, heading to that law of compassion, a beautiful pink mist, and allowing it to just pull you into that seventh plane energy, which is that's the source, God, creator of all that is, goddess energy, and just seeing yourself basking in that light from head to toe, clearing the energy of the day. And then bringing your awareness to your adrenal glands. They're just in the middle of your back, on top of the kidneys. They look like cute little hats. We're just going to say hello to those adrenals. They have their own, like every organ and gland, they all have their own unique, beautiful frequency and song and dance. And a part of this healing is going to support the adrenals and all the other organs and glands in kind of resuming their song, kind of clearing some of the shocks or other emotions, fears that are getting in the way of that beautiful song and symphony throughout your whole body. So we're returning to balance and harmony and peace and connection between all these parts of your body. So starting with the adrenals, we're going to come back to the adrenals very frequently in between all the other parts, as we're working to reconnect so that you can feel whole. You are whole. And this is about you really feeling like your body's working as a whole system and functioning better. So just bringing your breath and awareness. When you take a breath in, I'm going to guide you throughout these different parts of your body. Just intend that the energy of your breath, that life force energy, is going to that part. And if you don't know what these different parts of your body look like, it's okay. Just bring your awareness to the overall part of the body that I'm kind of giving you a location for. So checking in with those adrenals, breathing into them, and then bringing your awareness to this part of the body that's just in your below your breastbone, below the sternum. It's called the xiphoid process. It's that piece of cartilage that's just in your lower chest and upper belly. So just breathing into that part. We're going to be not only focusing on organs and glands, but also the nervous system and these different musculoskeletal tissues that include the deep front line that runs all the way through the core of your body from the inside of your head down to your big toe. We store a lot of stuff in that deep core of our body, some of our kind of deepest fears and shocks. So now bringing your awareness back to your adrenals. And just we're reconnecting these parts of the body so they can talk to each other more effectively. So if it supports you, if you're a really visual person, you might see like almost just like a light connecting these two parts of the body, opening up the highway of communication. So now go up to the pineal gland. And it's in the middle of your brain. I will give you a kind of easy way to locate that. If you put your fingers just above your ears on each side, one finger on each side, and if there's an imaginary line between your two fingers, that would bring you right to the middle of your brain where that beautiful pineal gland is. So just bringing your awareness there. seeing it, that part of your brain light up. It's a beautiful golden light. This part of the body is the master receptor of that universal life force energy that pours down all of us and through our crown. And whenever there's some blocks in this part of the body, it's much harder to heal anything physically. So we're going to give a lot of extra love to that pineal gland. It's a big part of our intuitive center, having good sleep, secretes melatonin. Okay, and then just bringing awareness back to the adrenals, energetically connecting the pineal with the adrenals. And then come back to the middle of your brain, just a little in front of where you were before is where the pituitary gland lies. And this is a really important gland for the hormonal system. It secretes hormones that tell the reproductive organs and glands and the adrenals and thyroid to secrete their hormones. So for the pituitary, it's really important that the pituitary be healthy and balanced. So we're giving some energy, offering some healing to the pituitary, clearing out anything in these parts of our body that are getting in the way. And that could be some stuck emotions. If anybody feels any emotions surfacing while they're in these deep parts of their body, just encourage you to breathe through it. And then connecting the pituitary with the adrenals, seeing that energetic pathway lighting up. And coming back up to the brain, right on top of the pituitary. So you're still bringing your awareness to that kind of middle, little front middle part of the brain. This hypothalamus is just sitting on top of the pituitary and giving orders to the pituitary, sending those messages and hormones to the pituitary. So she's really, really the boss. And coming back to your adrenals and your mid back on top of your kidneys. And up to your thyroid in the front of your throat. One of the 4 pillars that Dr. Vicky talked about. So just bringing your awareness to the front of your throat, breathing life force energy there. And back down to your adrenals. Helping them work together more effectively as a team, a harmonious team. And back up to the front of your throat, just behind the thyroid. There's usually 4 parathyroid glands, 2 on each side of the back of the thyroid. So just bringing that awareness back to the front of your throat on each side. Very important gland for many reasons, and the bones would be one of them. Very involved in calcium and vitamin D metabolism. And coming back to those adrenals. And then up to the thymus gland, which is right between the middle of your chest and your throat. So right on the top of your sternum. And if it helps you, you're welcome to put your hand on any of these parts of your body. This is an important part of the immune system in the chest. Our neurological system, our immune system, our hormonal system, they're all so connected and they all affect each other. And back down to the adrenals. Now up to the heart, the organ in the left lower chest. Pretty frequently when we stay long enough in our heart, there's some grief and losses that can surface. And most of us grow up suppressing our emotions. And it's part of the healing journey is to kind of reprogram that. And I try to encourage people to celebrate when emotions come up, because it means you're ready to process it, you're ready to release it. And all it takes is holding space for that, not judging it or shaming it or making it wrong, just acknowledging it, feeling it, breathing through it. And often it will just take a few minutes. You might want to ask if your heart has a message for you today. And coming back to the adrenal glands. And then bringing your awareness down into your pelvis. So the womb or the prostate area below the bladder. If you don't have a physical womb, that's okay. It's the energy center of the womb energy centers there. Whether you have a womb or not, whether you're a woman or man, we all have it. And so just bringing your awareness into that area between your pubic bone and your belly button is a good place to bring the focus. And just filling up that area with life force energy. So we're holding space for the womb, the fallopian tubes, the ovaries, and part of one of those 4 pillars. Release the sex hormones. Seeing those areas light up. And coming back to those beautiful adrenals. Work for so hard for us. Feeling that connection between the womb and the ovaries and your adrenals, opening up that channel of communication. Now heading over to your liver and your right upper belly, just under that lower right rib cage. Works pretty hard for us too. We can store a lot of anger and rage that wasn't processed in this part of the body, and I do see that quite commonly when with women that are struggling with menopausal issues, that they need help processing that anger because what they weren't allowed to show anger growing up. Got to be nice, got to be a good girl. So right now we're holding space for that liver to just let any energy go that's not serving you, any toxins to clear. We can transmute anything. Everything is energy, frequency, simply with our intention. Now back to the adrenals. And then over to the left upper belly, sort of lower left rib cage, the spleen. Purifies the blood as a part of the immune system. And back to your adrenals. And we're going to move to the pancreas in your upper middle belly, very close to your stomach. One of those four pillars secretes insulin, secretes digestive enzymes. And coming back to the adrenal glands. And connecting with those kidneys that are below those adrenal glands. You could start with one side if you like, in the mid left back, and then move over to the right side. So let's all start with our left kidney. That feels true for you. And clearing out any buildup of toxins, any emotions. We can store a lot of fear here, and also sometimes resentment can be pushed down from the back of our heart center into those kidneys. And then over to the right kidney. And seeing that beautiful connection open up between the adrenals on top of those kidneys and the kidneys. Now bringing your awareness up to this part right between your eyebrows, on top of the bridge of your nose, about an inch or so inward. You're starting to connect with this deep front line that I talked about. It runs down the entire body in the middle, the core of your body, and holds a lot of our deepest stresses. We can release the tension, our fascia and connective tissues. It can allow better blood flow, better nerve impulses, better lymph flow, which it just supports everything. So then coming back to the adrenal glands. And then up to the occiput, just at the base of your skull in the back, where your skull and your neck meet. And hold a lot of tension here. And then back down to the adrenals again. And down to the front of your thighs, that deep front line moves down front of the thighs. And coming back up to the adrenals. Then bringing your awareness into the sacrum, that bone at the base of the spine that's right deep in our pelvis, behind the womb and the bladder. Breathing into the back of your pelvis. Then up to the adrenals. We're almost done. Then down to your feet, bringing particularly awareness into that the inside of your arch, the side of your foot where your large toes are. That deep front line runs down the feet to the big toes. Just bringing that awareness into the inside parts of your feet. And feel the tension release in your feet. Now we're going to move to connecting the thyroid gland. So bringing your awareness back up into your thyroid, into your throat, breathing there, and then moving the energy of your breath and awareness up to this area between your eyebrows again. Breathing it up there, breathing it back down to your thyroid, just opening up that communication, that energetic pathway between the throat and this third eye area and the tissues. And then coming back into your thyroid and breathing down from the thyroid gland into that womb, prostate, pelvic region again. And just breathing between the thyroid, the throat, and this pelvic area. Just keep going back and forth, opening up that pathway, that highway, which is the energetic pathway of that we need to unblock this to fully be in our creative energy and our authentic creative expression. We're all here to be unique, authentic expression of source. And if this pathway is blocked, it's really challenging to do that, to express our true selves. So breathing between the womb, prostate, and the throat. This is a really common block I see in women with hormonal imbalances. Now coming back to your beautiful adrenals. And then up into the jaw, kind of right below your jaw and the upper part of your neck where this hyoid bone. So this is under your tongue. That deep front line runs behind the tongue. Now, one last time, just coming back into connection with your adrenal glands. And if you're a really visual person, you may just want to take notice to how the adrenals maybe look different, move differently, feel different, or there's just a knowing that they feel relieved with you coming in and saying hi and giving them some beautiful healing energy. They work very hard and are a really key part of hormonal balance, secreting progesterone and all these other hormones. We're going to finish just by balancing the craniosacral rhythm. So I'm going to just energetically, I'm bringing my awareness to the occiput and the sacrum, just making sure that the group's craniosacral fluid is pulsing nicely. And you can do that as well if you'd like, just simultaneously kind of breathing the energy between the back of your bottom of your head and your sacrum, the back of your pelvis. Beautiful. So just kind of moving your fingers and toes, bringing your awareness into the parts of your body, making contact with the chair, your feet on the floor, and opening your eyes when you feel ready. So I recommend that people consider listening to that recording as often as they feel like they need to, because you can never connect with your body too much. It,
Mm.
it's pretty hard to overdo this, especially if we're doing it sort of in this half-hour segment. And you can, I sometimes do this kind of process, this meditation over an hour or sometimes even longer so people can spend more time. So you could like slow down the speed of the recording if you want to spend a whole hour with all these beautiful parts of your body. So that's one of my call to actions for you, is to consider coming back to this. It could maybe every week, maybe if that feels right for you. I don't tend to give everybody that I work with the same suggestions. So I really recommend energy testing things. That's one of the things I teach my clients, because we don't all need the same thing. So some people might need to listen to this every day for a week and then they're good, or maybe every week for a month and that's it. And you could come back to it anytime. If you feel really, really stressed, there's a big shock happening in your life, this is really helpful in clearing that. And if anybody wants sort of one-on-one support, with kind of understanding how to heal yourself and tend to your own energy and transform your life, I do one-on-one work, and I also have a membership where my partner and I, who's also a former doctor turned healer, we do these kinds of things once a month, and we send out brief video recordings every week with practical tools that kind of help you take your power back and heal yourself. And that's all on my website. And I have free 20-minute, I call it a value call, that anybody could book if they just want to sort of get a feel for how I work, and I can give a few suggestions for what might help you, and see if we want to continue working together. So that's I think that's it for my call to action. I'll pass it over to you, Esther.
Okay, great. Let's welcome Dr. Vicky back as well, and I'll spotlight myself too, and we'll jump into the Q&A section in a moment, but is there anything else, Dr. Vicky or Dr. Melissa, now that we've had this chunk of time together that just, I must say it now before we get into the Q&A section?
Now, I just want to thank everyone for their attention. Melissa, thank you for your guidance. This is more than just one approach to wellness, and being aware that you have to pay attention to all facets, because that's how we balance our body out. So one is not more important than the other. They're all equally important.
Thank you, Dr. Vicky. Melissa, is there anything else that's coming to mind?
Yeah, I just love to remind everybody that no matter what you're going through health-wise, your body isn't broken. You're not broken. And it's your body's always trying to love you by giving you messages about the root causes, and just like to leave people with that there's always something deeper going on that you can get to, that honors your body and sort of, yeah, just acknowledges that it's speaking to us all the time.
Absolutely. Well, we'll start with a couple of the questions that I'm seeing now. We'll have about 15 minutes for this. And of course, listeners, if you have other questions, feel free to put them in the chat. This comes to me a lot when I'm interacting with people. And it could be a little tricky, but I'm going to ask both of you to answer this. How can you trust your medical doctor? And if you don't, or even if you do, but you want another opinion, how do you go about making that happen? Dr. Vicky, can you start us off?
Well, that was kind of the basis of my entire practice, is I saw the patients that everybody else was rejected by. And so when you are not validated for your symptoms, for how you feel, and you know in your heart of hearts that you're not depressed and that you aren't some of the diagnoses that Western medicine considers convenient to label you with, then it's okay to say to yourself, I need a second opinion. You're not saying that doctor is right, wrong, or indifferent, but you're saying, you know your body, and I'm going to get another opinion. We do that when we are doing an estimate for a new roof on our house. We do it if we're looking for an estimate for whether or not we need new tires on our car. We take it to a second mechanic. We get a second bid for work done on the house. So why can't we do that with our bodies? That's a much more important part of who we are and what's going to take us further down the road in the future. So you have every right to state that as a wish. You're the customer. They're simply the provider. And since when does the provider get the final say? What if they're not meeting your needs? Then it's not the right provider for you. It doesn't mean that they're a bad provider, but they're not right for you. So you need to find somebody right for you. Esther has a marvelous provider network in her Mind Myself, where you can find the kind of practitioners that you very well may just be looking for. And you're not committed to a second opinion, but you deserve a second opinion. You have that right.
I love that. Melissa, do you have anything to add?
Yeah, I agree, Dr. Vicky. And I would add that when we start to drop in more to our hearts and get comfortable with our own energy, and doing these kinds of meditations with ourselves, we can start to tap into like our body's yes and no. So that's one of the things I teach clients. Just bring in the energy of your doctor. How does it feel in your body? Do you feel like you're not being listened to, and maybe it's abusive or manipulative or authoritative? Or do you feel like does it feel like a yes, like it's a lighter feeling? It's more upward flow of energy is how I feel. A lot of people feel their yes, their body's yes. The no is more contractive. It's tense. It's like it's a heavy energy. So that's one of the ways that you can kind of energy test things to strengthen your own discernment, because it's all about like it's if we trust ourselves and our own intuition and discernment, then we know who to trust and who not to trust with our health. So, yeah, that's my advice.
Okay, great. We have another question about sweating, talking about hormones. So if I'm not sweating, no sweat beads like I previously had, but then I went back to sweating for a few weeks and then back to no sweating. So sweating, no sweating, sweating, no sweating. Is it the thyroid or something else? And what solutions would you offer at this point? Now, I know each person is going to be in their own experience. Why don't we start with you, Melissa? Do you have some suggestions?
Well, I do know that there can be many causes for this kind of lack of sweating, and one of them can be that there's like a buildup of toxins in the body, and so there are different ways of just gently and safely cleansing the body, which I can't really go into the details of that because everybody needs an individual sort of process. But with foods and different herbs, there's some really nice kinds of ways of cleansing the body. Yeah, I'll hand it over to Dr. Vicky for anything else she'd like to say about that.
Great.
Yeah, so sweating or not sweating, that could be thyroid, of course. That could also be your female male hormones. And again, I'm a scientist, as I'm going to take a look at the science of what your body is showing me. And if you're going through female hormone swing, that sawtooth pattern that you saw at the beginning of the graph and at the end of the graph, that's actually very, very common to have symptoms more than just hot flashes, which many people will call sweating, or night sweats that can still happen even during the day. But those are all associated with hormone imbalance or hormone swing, whether it's thyroid being impacted by what your female male hormones are doing, whether it's male female impacting thyroid, which may actually then have an impact on your adrenals, which is your stress gland, because golly gee, who has stress, right? Then realize it's all about how, as Dr. Melissa was walking us through so beautifully, how the body works with itself. It's an orchestra. It has to work in tune and together. If you listen to an orchestra and one instrument is out of tune, you know it immediately and you cringe because you hear it. So know that your body works in that same beautiful balance as well. So I work by science and I work by show me the facts, show me the numbers.
Thank you. Our next question is explaining the hormone sheet for a moment. And so, because people are not clear on what those symbols are. So what I'm going to do is, if I can find the share here, I'm just going to share my screen for a moment. And you can explain it, Vicky, when you see it. Do you see my screen there?
I see it, yes.
Okay.
So estradiol deprivation symptoms. That's one of your female hormones. So we also can abbreviate that as capital E deprivation symptoms. And you can see from that list, there's quite a few, and it involves multiple organ systems in your body. In other words, what that translates to is estradiol is responsible for blood supply per square inch to every organ system in your body that has estradiol receptors. Which organs are they? Every single one. So that's why you can have hot flashes. That's why you can have muscle aches. That's why you can have heart palpitations, migraines. You can have urinary symptoms, bladder symptoms, low libido. And I specifically mentioned low libido because that's a deprivation symptom of too little estradiol. On the second column, progesterone is your second female hormone. So when that second female hormone is too low, notice a lot of PMS symptoms and emotionality are the first basically 4 to 5 symptoms. Then we jump to your GI tract and people go, wait a minute, my GI tract? Really? Yeah. constipation and bloating. You eat one bite and boom, you feel like you've got to unbutton your pants. Well, that's not your fault. You're too low in progesterone. Water retention, breast tenderness, because if it's out of balance, you're going to have estrogen dominance because your progesterone is too low. Headaches go in both categories of estrogen and progesterone too low. So, but realize progesterone isn't just there to balance out your uterus. It's impacting your GI tract. It's impacting your emotionality. It's impacting your breast. It's impacting many other organ systems in your body. Too much testosterone, that last part of the second column, that's something that most people will say, well, isn't that obvious? If I'm losing hair from the top of my head, if I'm building a mustache or a beard. But what most women walk in with, and is the bane of every patient I would see, is the second last symptom, mid-abdominal weight gain. And their comment will be, Doc, I've gained 8 pounds, 10 pounds, 12 pounds. I eat less. I exercise more. What else can I do? Well, it's not your fault. It's hormone imbalance. And the faster we can get women to get off of that blame game of it's my fault, I'm doing something wrong, or your doctor saying to you, you must be hitting the cookie jar at night. You must be doing too much. It's that blame shame game. It is not your fault. It is hormonal. And the faster we can be scientific about showing you that it is hormonal, the better off you are, the more you're going to calm yourself down, the more you're going to balance those hormonal groups in your body, the more getting your adrenals in touch with all of your other organ systems and, your hormonal producers in your body, the better you're going to be. So it's really putting the science with the mind body, which is what this whole presentation was really all about.
Thank you, Dr. Vicky. In the original sheet, the words weren't spelled out, so I thought I'd bring that. So thank you for that. The next question is around estrogen and estradiol. Are they the same thing?
Estrogen is a generalized term versus estradiol is a very specific E2, they call it. There's E1, there's E2, there's E3. And there are probably other metabolites, but those are the big three estrogens as a class. So estrogen is an overall catchphrase versus estradiol is the basic E2, and that's what actually is going to help with reversing osteoporosis. That's what we're measuring in the bloodstream, E2. E1 is estrone, which is actually made from your belly fat. Ooh, really? Yep, and a tiny bit of estrone will convert to estradiol. And you go, oh, good. So if I gain that mid-abdominal weight gain, I'll have estradiol there, right? So I'm protected, but you don't have it balanced with progesterone. So you always have to take the good with, this consequence leads to this action. E3 is actually estriol. It is cancer protective. In the human body, it's approximately less than 1% of the estrogens that we make. But in a compounder's world, where they may be making an estrogen cream or a capsule that you are taking menopausally, they can actually add more estriol as cancer protection for you. So, but estrogen is more of a category name. Estradiol is what we're actually measuring because that's what we need to balance out.
Thank you. Melissa, do you have anything you'd like to add on that?
Yeah, just the other thing is that I think that one's talked about the most often because it's the most abundant subtype of estrogen and the most potent. So yeah, that's about it. It was pretty complete, Dr. Vicky.
This is so good. For both of you, and maybe Melissa will start with this. Our lack of emotions, more so the lack of feeling joy, happiness, etc., related to specific hormones. Melissa, can you start us off with that?
I tend to find, and this is not scientific because I've completely gone like the intuitive route now. So I'll let Dr. Vicky give the scientific explanation, and we complement each other really well. Um, and and you're very intuitive as well, so it's a beautiful balance. Um, yeah, so I find that when we're really disconnected from our emotions, which I also was for most of my life, and I still continue to work on that. The biggest thing, and I'll go into the hormones after, but is that you're not, there's a belief that you don't feel safe to feel them. It was like it was shut down early in life. A lot of our parents don't feel comfortable with us expressing our emotions. And so there might be a belief that it's just it's safer to kind of shut it down. Also, if we have chronic stress stuck in our nervous system, in our body, our vagus nerve is not active enough. We're more in that sympathetic overdrive, like stress overdrive rather than relaxation mode. We need to be relaxed to be able to feel our emotions. We need the vagus nerve, or that parasympathetic calm part of our nervous system, to be um, active enough to be able to slow down and feel them. Um, the other part that I often work with people is if we're disconnected from our feminine energy, then we often don't feel safe to feel. It's that like men and women have masculine and feminine energy, and men and women can be blocked in that ability to feel like we can land in the feeling part of ourselves. It's that flowing part, it's sort of softening, receiving. If we can't sort of be in that part of our energy, then so I would, when I find there's a disconnect with the feminine energy, there's often also an imbalance in the female hormones. So that's my kind of perspective on that.
Thank you, Dr. Vicky.
Well, as you know, then from that hormone symptoms worksheet, the emotions went under progesterone deprivation. So that was your increased emotionality and moodiness, anxiety, depression. And they're kind of called the PMS symptoms because that's what will rage in the adolescent with the up down on the graph. And that's what will also reappear in perimenopausal women with their up and down levels on the graph. So the beginning of the graph and the end of the graph mirror image themselves. So that's why we tend to call our adolescent daughters drama queens, send them to their room. It's also why many women in their 40s can be in the middle of a presentation at work in total command, and all of a sudden they break into tears and they can't control the fact that their hormones are swinging, and that can lead to very uncomfortable discussions with their boss. I've had women walk in and say, I'm in danger of losing my job and I'm getting demoted because I can't control my emotions at work. What's going on? But I also want to tell you there are normal things that in circumstances where hormone imbalance isn't as readily recognized, postpartum or breastfeeding women, when you go from delivery, when your hormones are like way up there, you're at 100th percentile of everything. And then you deliver your baby, and what do your hormones do? Wham! They hit the floor. And I've seen women go into psychotic break and need to actually be hospitalized in a psych hospital because of that significant drop off the cliff that is totally non-recognized by the medical community. And they simply state, oh my gosh, you're having a bubbling up of something that we need to medicate. And it's, wait a minute, are we even going to look? Are we even going to pay attention? So I really want to put everyone in the forefront of their brain. If you have something that's changing in you, then take a look at what the science of your body is telling you. Do you fit the graph? Are you age appropriate with your numbers for where you need to be? And look at the symptoms worksheet. But science is going to be factual. It's going to be something that you can actually hang your hat on. You can take it to your healthcare provider. You can talk to them about this is off, and at least start that discussion. And then you've always got Dr. Melissa's information about taking yourself back and tying all of your organ systems back together just to get yourself grounded again. But you still need science. You need information.
Great. And somebody has asked me, after the last session we had about a month ago, and she said, oh, well, this isn't for me. I tried hormones and because my doctor recommended it, but it was a horrible experience and it didn't work for me. So no, this isn't for me. I know that every body is different. Every mind is different. Every spirit is different. Every experience and context is different. What encouragement would you give to somebody who said, yeah, been there, done that, doesn't work for me? Dr. Vicky.
What I usually will say to them is, would you please bring your numbers in so that I can take a look at them? Would you please tell me how your previous doctor followed your hormone levels? Because there's a significant difference between being followed by blood levels, being followed by urinary levels, being followed by salivary levels. And they can be, quote unquote, completely in normal range in a salivary or urinary standpoint, and they won't even register on a blood standpoint. Why do we have these different ways of looking then? Well, to be quite honest, the ease of it being done, if you can order a kit and do it at home, it's easy, but easy doesn't always mean it's right. Okay. In other words, if it's easy to say, okay, I'm going to get the $2 part to fix my car instead of the $200 part to fix my car, it's going to be cheaper on your pocketbook, but how long is that $2 part going to last? Probably not very long. So you really have to think through, what is the test you're doing? Know that most of the research that has been published on hormone and its effect is published based on blood results, serum. And I want to emphasize that when you do salivary, realize we don't measure salivary in your brain. We don't know. We don't measure salivary inside of a joint. We don't know, is saliva there? That's debatable, right? Yet blood goes all through your body. Urine is metabolites, the breakdown product of what your body is not using, therefore getting rid of. Wow. So how does that really correlate with what your body is using? I really want you to think through, what is the test you're doing, why you're doing it. Is it for convenience? Then understand you may be getting the $2 part instead of the $200 part. So know the test you're doing and why you're doing it.
Thank you. Dr. Melissa.
Anybody that's interested in hormone therapy, I always recommend they look for an integrative medical doctor or a functional medical doctor that has more training in hormone balancing typically than the conventional medical doctor does. And a lot of conventional medical doctors will use the synthetic chemical HRT or hormone therapy. And both Dr. Vicky and I feel the same about that, there's a lot of potential harm that can come from that. But if you find somebody that knows how to prescribe bioidentical and is willing and has a lot of knowledge in that bioidentical hormone therapy, which is much more like it's your natural hormones, that's the way to go. If you're going to go with hormone therapy, find someone who can do that for you. I would stay far away from anything chemical or synthetic in that regard.
I find that so fascinating, and we have a division. I'm not trying to make the division. There just is. There's Western medicine, and then there's the holistic side of things. And my goal is to say, how do we integrate? And I hear you both saying that. And I hear so many people saying, yeah, but my doctor said, and it's not a holistic perspective. What
Mhm.
is your response to somebody who says, yeah, but no, the Western medicine, that's science. Vicky, you've been talking about science. How does this all fit together? As a wrap up to this conversation today, we're talking about hormones, we're talking about perimenopause, menopause, postmenopause, but in general, how would you respond to the difference between a regular conventional medical doctor and one who is open to integrative practices?
Well, in the Western medical system, which is the US, it is Europe, it is Canada, um,
Mhm.
is that they really don't teach hormone replacement. They actually, if you get 5 minutes of menopausal medicine in a 4-year medical school curriculum, that's a lot. Why? Because most medical school curricula is designed by the pharmaceutical industry. Does that help answer the question about chemical versus bioidentical? So they have an agenda, and their agenda is not to keep people off of medication. It's for doctors to be trained in using medication. By the same token, Europe, who is also very Western medical trained, is also much more open to blending traditional, non-traditional. Asia is much more open to blending more non-traditional than traditional. So does one mean that it's good and the other is bad? No, it's always a blend of, but realize that the highest body of research that is out there on women in menopause, perimenopause, and hormone balancing is actually out of Europe. And the term menopause in the first menopause meeting was actually held in Switzerland. So Europe is way ahead of us in the science of studying hormone and where hormone levels need to be. It's when the Americans tried to do the Women's Health Initiative, they wanted to set themselves apart that they had the better answer to the question of what women should take. They took a more pharmaceutical route and it backfired.
Thank you. Melissa?
Yeah, well, one of the challenging things that I think a lot of us know with the science of conventional medicine is that the practitioners that are only looking at the guidelines that the medical associations or colleges put forth, which is sort of like how most people should practice or, do something, is not usually very comprehensive, and it's missing a lot of really good studies that usually are maybe not so pharmaceutically inclined. So I think having some I've had to work through having more compassion for the fact that a lot of these doctors don't realize that they have been taught and they have all these guidelines that offer a really narrow kind of path. And that's why it's so frustrating because a lot of patients do a lot of research and see what else is out there. And whereas the more integrative, maybe functional medical doctors are looking at it all often and trying to integrate, and find the studies that resonate with them, that the best studies that are more holistic and looking at maybe some natural herbal options and things like that. So that's a bit challenging. And in Canada, a lot of people, have the public system family doctor that they don't have to pay for. And so you usually have to pay out of pocket for a more integrative functional medical doctor. And so if that's possible, I think I recommend that a lot of people just keep their family doctor if they feel like they can mostly trust them. They have a good relationship, they're kind, they're listened to, they feel respected, but maybe there's still some gaps in these other areas, like in most cases. But if they can and they can work with a more integrative private MD, which I'm not doing, I've completely let my license go, so I'm not doing any medical stuff. But having that balance of being able to work in the system and out of the system for Canadians is what I would recommend.
Thank you so much. I really appreciate that part of the discussion because it's so important in today's divided world. I think integration is so key, but how do we do that is the question. Any final words Melissa, before we end tonight?
Yeah, just remember that the answers always lie within you, and sometimes it's challenging to get those answers. But if you allow yourself to slow down enough and be in that still place enough and connect with your heart, the answers are there. What your body needs, whether it's HRT or a herb or a supplement or a particular practitioner, your body, your energy knows what you need. So just sink into that and ask what it needs and trust yourself.
Thank you. Dr. Vicky, take us home.
Thanks. And I couldn't have said it better. I'm going to add, though, that use your symptoms that you're having, use them to help guide you. Those symptoms are real. You're not making them up. So validate your symptoms, document your symptoms. That's what that symptoms worksheet is all about. And then realize that they're connected to specific hormones that are deficient or in excess. Wow, that's literally giving you your opening with your healthcare provider to say, I've done this part of self-diagnosing what I have going on, and this is changing, and I need answers, and I'm seeking answers with your help. You're not trying to be aggressive. You're not trying to tell them they don't know their job. You're simply there as a partner to work with them. And isn't that the point? Don't you want to feel that your doctor is working with you instead of against you? Ah, that's, you're not saying, Doc, I don't trust you. You're saying, I'm giving you information you may not be aware of. Will you work with me? Will you help me? Will you do the blood work I'm asking for you to do? I am seeking answers. And that's really all we want. We don't walk into a doctor's office expecting we're going to be put on meds. No, we want to be told that you're maybe a little out of balance. Here's how we're going to rebalance you, and we're going to get you back to where you were. Oh, and by the way, if you feel 15 to 20 years younger than your age, little bonus. Is that okay with you? I would say yes in a heartbeat. So, yes. So it's okay to take charge and ownership of your symptoms. Don't hide them under a rock. Own them, because that means something. And if it means something, find out how you can work with it, rebalance it, and get yourself back to where you want to be.
Excellent. I'm going to end with a couple of short quotes. Morgan Harper Nichols says, "One day you will look back and see that all along you were blooming." And so that's the title of Dr. Vicky's book, Full Bloom. If you don't have it yet, definitely urge you to go buy that. And both Dr. Vicky and Dr. Melissa are open for consults. Absolutely reach out to them. And then finally, Eleanor Roosevelt says, "Beautiful young people are accidents of nature, but beautiful old people are works of art." Thank you so much for being here. Thank you, Dr. Melissa, Dr. Vicky. As always, it's been a pleasure. And for each one of you who's taken the time to listen, to be here in the flesh, or to be listening after, time is precious and you've spent some of yours with us. So thank you. And we do this because you matter. Thank you.